Hey guys, and welcome back to part 2 of managing and preventing skin tears. Okay, so this is best practice standards simplified. So in this part 2, we're going to look at the last 2 steps, which is establishing and implementing a plan of care and evaluating outcomes. So let's get started. But first, if you could hit that subscribe button, it would be greatly appreciated, as it does help my channel reach more people. So let's get started, guys. So number 4, establishing a plan of care. We need to have a plan that everybody is involved with and agrees with, including the patient. Please always include the patient, because that is so important. Everything hinges on the patient and what they do, especially if they're at home and you're doing this in home care. As soon as you're gone, they could be ripping off the bandage if they don't like it, and if they don't agree with it, or it hurts. If there's something that they're not like, the healability of that wound goes way down low. I've come into contact with this many times, where a patient just doesn't like the bandages, they don't like the looks of the bandages, and they're taking it off, or they don't like the compression, or the compression's too tight, then they're taking it off, and we don't have healing, and we're kind of wondering, like, what's going on here, because it's an at-home patient and they are just telling you, hey, I just took off my bandage and took a shower right before you came, but it was actually them taking off the bandage right after you left. So we want to make sure that they're on board, they're agreeable, and can actually keep the bandage on, or if they need to change the bandage, they can do that. Okay, so first we're going to look at the risk factors and look at different patient strategies and home and healthcare professional strategies that we can take to implement into our plan of care if they fall under that risk category. So number 1 that we're going to look at is altered sensory, auditory, or visual status. So what are things that the patient can do? They're going to participate actively in care. So maybe they can't hear or see properly, but if we're showing them how to do it and they can actively participate, they can feel it for themselves, this helps a lot. We need them to be cautious of the environment and have regular vision and hearing screening. Now, for the healthcare professional and caregiver, what can we do? So we're going to ensure a safe environment, implement a fall assessment program, assess footwear, assess sensation, especially if the patient has diabetes. We're going to assess for clothing that can injure the patient. Next, we have patients with cognitive impairment. So what can the patient do? We're going to have them participate actively in the care as applicable. Okay, if they're able to, we're going to include them, and we're going to have them be cautious of the environment. Okay, skin tears are really on the environment that we're in, making sure that we just don't have really sharp edges or things that can cut us. Okay, like I said, as you get older, you do start getting more skin tears because our skin becomes more fragile with age. And I have actually seen it where somebody had a big skin tear on their arm, and it was from their actual door. So the piece that like goes in and out, they had rubbed against that just in the wrong way, and it ripped their skin right open. So we ended up, it was a sliding door to the bathroom. They were elderly, lived by themselves. We were able to just tape it because we weren't worried about people walking in or out when the door was closed and not locked. So we put a piece of tape across it, so she was not going to have her skin ripped on that again. So what can we do as healthcare professionals to help patients with cognitive impairment? So we're going to consult an occupational therapist. We can utilize a confusion assessment method if the patient is exhibiting signs of delirium. We want to ensure a safe environment, that there's not rugs on the ground that they can trip over, fall, We just really need to be looking at their home completely to make sure that there's not things that are going to trip them up, maybe fall into a wall, fall into a door, whatever it might be. We got to be very cautious with that. We also want to make sure that we're informing the patient and their families that, hey, we can't have these long running rugs in their house, or these mats kind of scattered all over the place. They're tripping hazards and can cause problems. Okay, so we just want to educate the families on these potential risks, and then we also want to protect an individual from self-harm if that's possible. If there's anything going on, we do need to help protect that. Next, we have nutritional concerns. So obviously we want the patient to optimize their nutrition and their hydration, because nutrition and hydration, it's one of the things with wounds that's very underrated and not looked at enough. Okay, we need to optimize nutrition. If we do that, it really helps boost the healability of a wound. So what can we do as healthcare professionals? Obviously, if we think that there's an issue with optimizing nutrition, getting in the nutrition that they need, their hydration, we want to get a dietitian involved to promote, monitor the nutrition that the patient is getting to optimize their body for. Okay, and then we have polypharmacy. So we do just want the patient to be aware when they are on multiple medications. It has been shown that if a patient is on more than 4 medications, they are at higher risk for falls. So we just want to make the patient aware of that, to be conscientious of what they're doing. Get up slowly. If they do get dizzy when they go to stand up, just educate them. Okay, now what can we do as healthcare professionals? So we're going to consult with an interprofessional team to monitor the effects of their multiple medications and the individual skin, because certain medications can also increase the risk of skin thinning. Next, we're going to look at mobility. So risk factors with decreased mobility. So mobility and the patient. What can the patient do? They need to be very conscientious of the environment that they're in. If they're having mobility issues already, for some reason, the older population loves those carpet runs. I don't know why, but I see this so frequently in homes of elderly patients. They love to have carpet runs. These are honestly just a disaster waiting to happen, and I've seen it where they have flipped over them. They're trying to get their wheelchairs over them and they're flipping. It's just not a good scenario. So we as healthcare professionals, especially going into the home, we're going to educate. We're going to consult a physiotherapist to promote stability. Okay, make sure that they have the equipment and technique that they need in that home. The next risk factor comes along with activities of daily living. So we want to make sure that we're always involving the patient. They need to do for themselves everything that they can do. We should only be helping with them with things that they absolutely can't. So what are we going to do? We're going to make sure that we're providing protection from trauma during their daily activities. Okay, so there's not sharp objects, there's not things for them to trip over. We're protecting their environment, kind of simplifying it, I would say. We can always have an occupational therapist come in and help with home safety. And we're also going to provide information to their patient, the family. We're going to educate. We can show different methods of how to transfer patients who need to be transferred, so that they're doing it safely in a manner that's not going to harm. Next, we're going to look at age-related skin changes. So for the patient, we once again just want them to be very cautious of the environment, be aware of the risk of your skin, because it is changing, it has changed, so we have to be very cautious with our skin. They can also add moisturizer to their skin, okay, because we can do that as a healthcare professional, but especially when somebody's in home, we want to make sure that they are hydrating their skin. This will help reduce incidences of skin tears. And we also want to use just very basic soaps. If the more natural, the better. no sense. It's really good and it helps our skin. It reduces irritation to the skin if you are having any irritation, to more harsh soaps, because soaps can contain a lot of harmful toxins in them. So if we just have like a natural basic soap, it does help our skin also. So next we have optimizing the local wound environment. Okay, so this goes into 3 different parts. So we have cleansing and debriding, bacterial balance, and moisture balance. So for cleaning and debridement, we'll start with cleansing first. So for simple skin tears without any debris in them, we can just cleanse them with some normal saline, sterile water. We're just cleansing that wound. We want to avoid putting too much pressure. If there's any dried blood there, we want to, you can take a Q-tip and just kind of help lift it while you're running some saline over it. And we want to just gently place, if there is a flap there, put it back into as normal of a position as you can. Sometimes it'll completely cover the whole skin tear, or sometimes it's a partial flap where it'll only stretch over half of it. That's okay. We just want to put it back into the normal position after we've cleaned. Now, if the skin has been pushed back and it's not really sliding, what you're going to do is you're going to moisten it with the saline, and then you're going to take a saline soaked sterile gauze, and you're just going to put it over it, leave it on there for about 5 minutes, and then you can more than likely reposition it back to where it belongs a lot easier. So the second part of this is debriding. So this is where we remove any non-viable tissue. Now, I do want to state that be very cautious with this and make sure, for one, that you're trained to debride. Especially for sharp debridement, you do have to be a trained professional for this. There are many different methods of debriding. I can put the link in the description because I do have a video on that. But before we ever debride, we want to make sure that there is good blood flow to that area, because if there is not, most of the time we'll just leave it as long as it's stable, like eschar. So that hard black eschar, we normally just leave it. We won't debride it, but if there is good blood flow, we can remove that non-viable tissue. It's recommended for skin tears in particular that we're always consulting a wound care professional, wound care specialist, to see if it should be debrided, okay? Next, we have managing bacterial balance. So if there is true infection in the wound, we do need to treat it with antimicrobials. So you have your silver, your povidone iodine, your chlorhexidine. There's a bunch of different antimicrobials that you can use, but we also want to be very cautious because right after having a skin tear, this is trauma to the skin, and a lot of times we have a lot more inflammation with skin tears. So we want to be cautious that it's not just inflammation, and it is true infection. So we want to be using our NERDs and stonies. If you're unsure of what NERDs and stonies are, I'll put another link down in the description for NERDs and stonies. And that's just showing whether we have a local infection or deep spreading infection. And lastly, for looking at the wound, we're looking at moisture balance. Okay, we want to have a just moist wound. Okay, so about the moisture of an eyeball is how moist we want our wound to be. That is the optimal for healing. So normally we use different bandages to help with moisture balance, okay? Some dressings will donate moisture, some will absorb moisture, some just kind of leave it where it's at, okay, if you have the perfect moisture balance already. So make sure that you know your different dressings, what type they are, and if they're absorbing or donating moisture, what are they doing, because what do you need in that wound? You always need to look at what the wound needs, and you want to give it what it. So we'll look at this little chart here. It's going to show the different product categories, what type of skin tear it can be used on, and the indication. So we have non-adherent meshes. Now these can be really used on type 1, 2, or 3. Now this is for dry or exudative wounds. So these meshes, they do have little holes in them. It will hydrate the wound just very, very slightly. So it's just putting that contact layer, so the outer your cover layer isn't going to stick onto that wound. It's not going to give and donate too much moisture to the wound itself, but it's going to make sure that nothing sticks to it. Okay, and this can be used for type 1, 2, or 3. Next, we have foam dressings. Now this can be used for type 2 or a type 3, and this is for moderate exudating wounds. Okay, so the foam is going to absorb moisture, so you want to make sure that it is a moderate exudating wound, and it does have a longer wear time of about 2 to 7 days, depending on how much exudate is coming from that wound. Next, we have hydrogels. So hydrogel, it hydrates. So this is for type 2 or 3, and we're going to add this to extremely dry wound because this donates moisture to the wound. A lot of times we only have to add this a few times, and then the wound kind of stays at level of just moist wound that we need, and we can go to the non-adherent mat. Next, I have added in here skin glue. Now this is more for type 1 for a closure of the actual skin tear. Next, we'll look at calcium alginate. So calcium alginates, it can be used on type 1, 2, or 3, and these are used for moderate to heavy exudating skin tears. Okay, really any wound moderate to heavy exudating, that's what the alginates are used for. Same with the hydrofibers. So the hydrofibers are used for moderate to heavy exudating, but it's only recommended for type 2 and 3. And then we have the acrylic dressings. Now these are my absolute favorite. They can be used for type 1, 2, or 3, and they have an extended wear time. I'll put a picture in here of what it is, and this is a really cool dressing. So it's see-through dressing, almost like a Tegaderm, but it has this little gel layer. Now it will absorb moisture into that layer, and it protects the skin from any bacteria getting in. They can be wore up to 21 days. Okay, they have that extended wear time, and most of the time these wounds are healed by the time that we're taking them off. You just want to make sure that you see which way the flap is before taking them off, so you're peeling it in the same direction of the flap and not against the flap to peel it upwards. Okay, back and upwards. I have had really good success with these, as long as we don't have that moderate to really heavy amount of exudate. They work really, really well. So they can be used up to a moderate amount of exudate. Next, we'll have a peek at the different antimicrobials that are suggested in best practice for skin tears. So we have methylene blue and gentian violet dressings. Now these can be used for types 1, 2, and 3. It's a broad spectrum antimicrobial, and this does include antibiotic resistant organisms. And then we have our silver dressing. So this is good for type 1, 2, and 3. Now silver dressings, they can come in the alginates or the hydrofibers. They come in even the meshes. So there's a lot of different forms the silver can be on. All these different forms of dressings, depending if you have a low, moderate, high amount of exudate. So you're just going to determine what you have and what silver product you'll use. But once again, it's a broad spectrum antimicrobial, and it also works on antibiotic resistant work. So once we have the plan of care, we want to make sure that all people on the team are included in this and implementing the plan of care. Because I've seen it so many times where, especially in home care, one nurse will go in and do one thing, and then another nurse will go in and do another thing, what she thinks right. We have to have this plan of care and everybody on board with the same plan of care. That's going to optimize healing and give us our best healing ability. Because once we've gone through and done and looked at this whole circle to create this plan of care. We've done it for a reason. Yes, we can have different plans of care and different products that we're using, but we want to be on board with one thing. And if the plan of care changes when we reassess, then at that time we change. So step 5, we're on our final step. So we're evaluating the outcome, okay? So we're going to determine if our goals have been met. Have we either prevented skin tears, if that was our goal, or are we progressing towards healing because these wounds should be healed within 7 to 21 days, okay? That's what the standard is for skin tears. So are we progressing towards our goals? Have they been met? Okay, so if they've been partially or not been met, we need to reassess and go right back into step 1. We need to look at why it's not healing. What's going on? What's the causative factors? Is there any underlying issues? Is there any problems with our plan of care? Is there something that we're missing? And then lastly, we just want to support prevention and risk of reoccurrence, okay? So even if the patient still has that skin tear, we still want to work on prevention and risk assessment, making sure that we don't have another wound, because once again, prevention is always over cure. It's how we help our patients, because once there's a wound, it has a financial burden, whether it's on the patient, their family, on the healthcare system, depending on where you're located. There is that financial burden. There's a burden to the patient, the quality of life. So we always want to prevent, okay? Now that's all I have for this video. If you are looking for the best practice simplified for skin tear, if you're looking to print all this out, I do have it uploaded on my Etsy store so you can print it out, okay? So I'll link that down below. That's all I have for this video, guys, and I hope to catch you in my next one. Bye for now.